Welcome, everyone. We will get started in just a minute. Please feel free to introduce yourself in the chat as you join. It's great to see everyone coming on for the session on demand creation. Looks like we have participants joining from Nigeria, Burundi, Mali, Rwanda. Welcome. Aubrey, let's go ahead to the next slide. So for those of you who are interested in joining the webinar in French today, these are the instructions for accessing the French interpretation. If you'll see at the bottom of the screen on the Zoom platform, there's a globe with interpretation at the bottom. And if you click that globe, you'll be able to choose which channel you want to join on. There's English or French. And if you are joining in English, you can just leave the interpretation feature as on off, as it's shown on the screen here. And if you prefer to join in French, go ahead and click French and also mute original audio. And that way you won't hear both presentations at the same time. So feel free to adjust that as well. Welcome. I see people are joining from Côte d'Ivoire. Excellent. And I think up on the screen is the French translation option, if that's helpful for you. The slides will be presented in English, and we circulated the French slide deck in advance of the call. Casey, maybe you could let people know to reach out to you on the chat if they do not have but would like the French slide deck.
Okay, sure.
Okay, Casey, let's go, or Aubrey, sorry, let's go ahead to the next slide. I think everybody is introducing themselves on the chat now. That's great. There's also a few other Zoom features. Oops, can you go back, please? There's a few other features on Zoom that we wanted to talk through. If you click on the participant menu down below, you can also see other features such as the yes, no buttons. There's also reactions that you can give on the main screen. Feel free to show a few reactions if you'd like. It would be also be great if you are listening in on French. You can use the yes or no button on the participant screen and let us know. Everybody's usually, given the size, we will leave people on mute, but during the Q&A, likely be able to open up for questions and answers using audio, or feel free to put questions in the chat feature as the presentations are ongoing. Great, next slide. So welcome, everyone. My name is Katie Schwartz. I'm with the Choice Collaborative and FHI 360. Just wanted to give a brief introduction to Choice. If you have joined these webinars in the past, then this will be familiar to you. But those of you who are joining us for the first time, Choice is a 24-month collaboration funded by USAID in partnership with PEPFAR that's through two central mechanisms: meeting targets and maintaining epidemic control, or the EPIC project, and reaching impact, saturation, and epidemic control, or the RISE project. The goal of this collaboration is to address the technical gaps and support national scale-up of ARV-based HIV prevention products in PEPFAR countries through catalytic evidence generation, translation, and research utilization. So Choice is led by FHI 360 and JPIGO in partnership with Afton Bloom, Avenir Health, LVCT Health in Kenya, and Pangea Zimbabwe AIDS Trust in Zimbabwe. Okay, next slide. So more about this learning network can be found on PrEPWatch. You can access previous webinars and presentations there. I do have to say that the webinar recording was not available from our October session, unfortunately, but both French and English translated decks are there from that previous session, which was on community-based delivery models. Next slide. So key topics for this webinar series fall along this oral PrEP introduction framework, different parts of the framework in the process: planning and budgeting, supply chain management, ring delivery platforms, uptake and effective use, and monitoring. Today's session, focusing on demand creation, falls into this bucket of effective uptake and effective use. Next slide. And here's an overview of our webinar today. We will hear about the key lessons learned on demand generation for oral PrEP. We'll hear from the Jilinde project in Kenya on how they've created demand for PrEP among MSM and FSW. We'll hear from the Jilinde team in Lesotho on creating demand for PrEP among adolescent girls and young women, and then have some wrap up. So there will be plenty of time for questions and answers after each of the country presentations. Go ahead in the next slide just to introduce our speakers today. Feel free to put yourselves on video if you'd like. There's Manya Dotson from Jilinde. Good morning, Manya. And then we have Igalgal Kiramburu from the Jilinde project in Kenya. Polo Motwari from Lesotho, the Jilinde team. Hi, Polo. And we have Brian Pedersen from FHI 360. Great. And just a quick revisiting of the French interpretation instructions for those of you who've recently joined. You can access this presentation in French if you'd like by going to the interpretation globe at the bottom of the main Zoom screen. Click on the French translation and mute original audio if you choose to do this method. Otherwise, you will hear both languages at the same time. And so you want to make sure you've muted the original audio. Okay. Anyone listening in English can leave the interpretation feature to off. Okay, before we get started, let's do a quick poll. Where are you in your PrEP demand creation efforts? Have you not yet started? Have you only recently started, so you're looking for more ideas? Have you been doing it for a while but need to do more and better? Or have you been doing it for a long time and everything is going perfectly? Okay, you'll have about 30 more seconds to vote. We have about half of the people voting so far. Keep them coming in. Okay. And ending the polling. I think you should, does everyone see the results? Looks like almost half have been doing it for a while, but need to do a bit more or do it better. Okay, great, that's really helpful. And next slide. So great, I will turn things over then to Manya to go over the key lessons learned. Over to you, Manya.
Thank you so much, Katie. Can you do the next slide, please? First of all, let me greet everyone. It's such a pleasure to be with you today. And I'm so excited for you to hear from these country programs and some of the incredible work that they have done, since many of them are now 3, 4, 5 years into their PrEP journeys. So we're excited to talk about PrEP, and I'm very excited about PrEP as something that is fun and cool to promote and to get people excited about, because there is a lot to get excited about. First of all, finally, we have a new option beyond abstaining, being faithful, and condoms. You don't have to negotiate with your partner to use PrEP, though many people want their partners to be a part of this decision, but you don't have to. It is completely within your control, whether you are a woman or a man. It does not interfere with sexual pleasure in any way, as some people feel that condoms do. And it is very, very effective at preventing HIV infection. So there's a lot to be excited about. Next slide. And something that we've learned is that, a lot of countries right now who are beginning to launch PrEP and introduce PrEP in their market or in their country find themselves in a situation where they have big targets, they need to get started right away. And so they just jump right in and start promoting PrEP and talking about PrEP. And something that we have learned across the many countries who have introduced PrEP is that it's important to have a strategy, to think about sequencing of how you are going to communicate about PrEP, and to understand that over time, communication objectives and calls to action change and evolve. So at the beginning, we're trying to increase awareness about PrEP, and some of our objectives might be that a percentage of the population knows that PrEP is a new HIV prevention method, that people know where to get PrEP. This would be, increasing awareness. There's something new. Our call to action might be learn more about PrEP and spread the word. We need to build acceptance for PrEP. This could be things like people believing that PrEP is safe for anyone to take. People believing that taking PrEP is a good or a responsible thing to do. People believing that, people saying that they would suggest PrEP to someone that they care about if they thought that that person might benefit from PrEP. So here, our calls to action might be recommend PrEP to people you care about. Encourage anyone you know. Sorry, I've got a little... encourage anyone you know who is using PrEP and encourage them. So these are more things that we do to create an enabling environment for PrEP use. And then when we start talking with individuals about whether or not PrEP is right for them, there we're looking to spark desire and support their commitment to taking PrEP. And in these, in these phases of communication or these channels of communication, our messages are a little bit different and our objectives are a little bit different. So in this case, we may be asking service providers, ask the service provider at your nearest branded health facility about PrEP. Take your PrEP pill every day, encourage others to use PrEP too if you think it could be good for them. And you can see here that our objectives, again, evolve. Next slide. Lesson number 2 is that different audiences support PrEP use in different ways through different behaviors. And this is really important with PrEP because something that we are discovering in our more mature PrEP programs is that if we do not create an enabling environment around PrEP use, it really hinders PrEP users' ability to sustain use of PrEP. And we're really looking at some key groups here who have different behaviors and different ways that they can support PrEP use. We've got peers and sexual partners who can, make it look cool to use PrEP, or they can shame people who are taking PrEP. There's all kinds of things that peers can do to support friends with adherence, to encourage friends to check out PrEP. Parents can, especially for younger users, can really encourage PrEP use. They could help their sons and daughters get information, get to the clinic, remember doses. Even just not protesting or arguing if they find their child using PrEP could be a very constructive behavior that would support a person at risk of acquiring HIV who is trying and using PrEP. Providers have a big role to play in reassuring clients that PrEP is safe and effective, helping clients make a continuation plan, talking about PrEP within the community, and of course, community influencers who can, influence community norms and beliefs, can promote PrEP as a community good, can celebrate the arrival of PrEP, and can agree to not talk badly about PrEP or not stigmatize PrEP. Next slide, please. Lesson number 3 is that careless communication can backfire. So we are really encouraging people to think very thoughtfully about the images that you associate with PrEP, and particularly when you're first starting to talk about PrEP in a new program or in a country that is not yet, does not yet have a big PrEP program. PrEP can be very easily stigmatized. So we'll have a temptation to go directly to promoting PrEP among key populations. And that can very quickly stigmatize PrEP for everyone and make it harder for those individuals to access PrEP later. So, we need to be careful about the ways that we are talking about PrEP in a very public and en masse media. And then have a different strategy that we use in a much more subtle and quiet and interpersonal way that's about igniting desire and supporting commitment. And we saw this in South Africa, for example, where there was an attempt to begin talking about PrEP as really good for young people, and that stigmatized some of the first PrEP use, and they've gone back and have relaunched a more general campaign that's about creating more societal acceptance of PrEP. Next slide, please. Another lesson is that we need to address the big motivators. A lot of PrEP messaging at the beginning talks about functional benefits, which are, and so we assume that if you just increase risk perception, or if people know that they're at risk, that they will be highly motivated to take PrEP. And that is not something that we have seen hold true as the things that motivate people to take PrEP long-term. And the things that we see that motivate people are pleasure. So the idea of being able to enjoy intimacy with their partner without a condom, alignment with their values. So sometimes that's being excited and investing in yourself today for the growth and achievement you will have in the future. An immediate reward. We've heard some female sex workers, for example, talk about how for them, PrEP has reduced partner violence with clients because they don't feel that they really need to argue as much around condom use, et cetera. So it's reducing, it helps them to negotiate from a position of more strength, feeling safe and secure, feeling love and belonging, like being a part of a community that's a PrEP queens, or if it becomes a sign of belonging. I'm part of a group of young women who really cares about themselves and cares about their future. Avoiding shame and anything that creates respect or status. All of these things are kind of universal motivators that we can think about how to tap into these things as we are persuading people to try and continue using PrEP. And just in the same way that if the experience is unpleasant, if it does not align with their values, if there is no reward that they can feel immediately, if they don't feel that it makes them safer, if it leads to them being rejected, if it leads to them feeling shamed, or if it leads to them losing status in the community in some way, all of those things are powerful motivators to keep someone from using PrEP. Next slide, please. So this is a heavy slide with a lot of details, and I would encourage you to look at this afterwards. So on the right, you see these circles that are talking about those different communications objectives that evolve over time. And so one of our lessons here is to sequence the way that you are introducing and talking about PrEP, and that we use, and so you see that it is sequenced kind of from 1 to 12, and that as you move down this sequence, you see that it is that the communication approaches are getting more and more private, more and more targeted, and more specific to an individual. And you see also that there are these different communication channels that respond well and that go from kind of the most public and the most general all the way down to the most intimate, which would be counseling and individual mentors. And that these different channels correspond with these different communications objectives and these different types of messages. So to be thoughtful about how you engage those different channels and what kind of message you're delivering to who. So these things at the top, these first two, becoming aware of PrEP and accepting PrEP, are about the enabling environment, and those are more general. When it's getting people to want PrEP and commit to PrEP, that's more specific and it's more private. Next slide. You know, another big lesson that we have is that providers are people too, and that they need to be convinced. We hear that, and this data is coming from Nigeria. There was an online survey done with PrEP providers. They're very excited about PrEP. Providers are excited about PrEP because they believe it works, they believe it's safe, and they believe it's good for discordant couples and certain key populations. They are reluctant because they feel uncomfortable with adolescent girl and young women clients, especially young women who are under the age of 18 and or unmarried. They're reluctant because they fear encouraging immoral behavior. They fear increasing people's risk of getting STIs. They feel committed to condoms and abstinence, fidelité, and abstinence to A, B, and C and condoms. And so they feel that there's a responsibility to continue to really push A, B, and C because we have for so long. They doubt that clients will be able to adhere, and sometimes they make decisions there. And they really fear community backlash, particularly if they are giving PrEP to adolescent girls and young women. And we hear that they're craving tools and materials to help clients, nuanced information on what good enough use is. Does it have to be used perfectly for it to be effective? They want reassurance about commodity security. They're really craving refresher training. They're craving some specific training in dealing with adolescent girls and young women. And they really are craving support from the communities in which they work. So if we need to be considering providers not just as trainees learning about the technical aspects of PrEP, but as people who have their own beliefs and needs. I think we're at the last slide now, one more. Oh, two more. So lesson number 7 is that PrEP continuation can be difficult, that we see a lot of folks, particularly young users in many programs, trying PrEP and then dropping off of PrEP after just 1 month. And, the idea here is that we really need to keep working on this in our programs. The benefits need to outweigh some of the drawbacks. So some of those drawbacks are side effects, social friction, and inconvenience. If it's easy, if they see a clear immediate benefit, if it hits the motivators, if it creates a sense of belonging and a sense of fun, those are elements that can help to that can weigh and offset some of those inconveniences. And we see that with preventive measures, people are much less tolerant of inconvenience because they don't need to take PrEP every day the way that you would need to take antiretrovirals. They're less tolerant of things that they might tolerate if they knew they needed that medication every day to stay feeling well. Last slide. The final thing is, and I think that Brian is going to discuss this a bit at the end, is that, if PrEP begins to be equated with promiscuity, then it really hurts our PrEP efforts. We must norm and destigmatize PrEP to create demand for PrEP and to create an environment where people can continue taking it. And, I think we're going to talk at the end about some of the complex dynamics inside of stigma. And if PrEP is perceived, to enable immorality or be proof of promiscuity, increase sex, or hide antiretroviral use, then it can get very easily stigmatized. So, we've got to think about as programs how we make sure that PrEP is perceived as a smart and respectable choice that is morally positive and a sign of health and prudence. And I think all of us as a community need to do some really, really crack our heads to think about how we can do that, particularly in any messaging that we're doing to the general population. So I think that's all my slides. Thank you all so much. And I'm curious to see if there's questions that come into the chat.
Sorry, I was on mute. Thank you so much, Manya. I haven't seen any questions come through yet. But while people are reflecting on that, perhaps we move on to the next presentation. And I will invite Igelgal Kiramburu from the Jilinde project in Kenya to talk through the creating demand for PrEP amongst men who have sex with men and female sex workers. So go ahead, Igelgal.
Thank you, Katie. And thank you, Manya, for setting the stage for us. So I'll be taking you through how we've been able to create demand among men who have sex with men and female sex workers in Kenya. Next slide, please. Now, just looking at the profile of our HIV epidemic in Kenya, and this is what more or less guided our project's decision into product introduction in Kenya. And this was based on the HIV prevalence, which was standing at 5.6%. And then also looking at the HIV burden among the different populations. Among the sex workers, the HIV prevalence was at 29.3% and MSM was at 18.2%. And then looking at an age group of the young people of 15 to 24 years, we had about 51% of new HIV infections coming from this specific group. Next slide, please. So for our project Jilinde, there were different milestones that more or less now shapes the introduction of and why Jilinde even came to Kenya and now introduced PrEP and scaled it up. And one of them was around, the scientific data that came from the demonstration project, as well as the trials that were done for PrEP, which more or less was able to show the efficacy of PrEP in preventing against HIV. And then also in Kenya itself also, there were certain milestones that even from a national government level that we were able to achieve, and which was around the launch of the revised ART guidelines, which included PrEP. And then also our project, which launched in September of 2016, 2016. We were also able to work directly with the national government and just being able to be involved in how in the formation of the PrEP technical working group, where now different implementing partners were sitting together to see how PrEP needs to be introduced into the country. And now there were also several other milestones that came up over the years. And this among them was, in 2017 in May is when now we were able to now launch our national PrEP campaign with help from the national government. And then also there was toolkits that we were able to develop as well, which was a PrEP implementation toolkit, as well as, PrEP provider toolkits as well. Next slide, please. Now, just to give you a quick summary in terms of our project itself. So for us, our project was formed on the basis to want to demonstrate and to document an effective model of how oral PrEP can be scaled up as a HIV prevention intervention in low risk settings. So we had 3 goals. 1, to demonstrate. 2, to be able to document and develop, an acceptable and affordable way that we can be able to, scale up PrEP in the country. And then 3 was also to ensure political donor and community support as well. Next slide, please. So for us as a project, Jilinde, one of the key defining questions that we asked ourselves was around how might we be able to drive uptake and continuation of oral PrEP among high-risk populations in Kenya. And for us, we were looking at how, 1, we'd be able to drive the uptake, which is to increase and initiate PrEP among populations at risk. And then the second thing is around, how do you just be able to promote, adherence regime among the users themselves. And then the third thing was around, who are the high-risk populations? And as a project, we focus on 3 populations: the female sex workers, the men who have sex with men, and the adolescent girls and young women. And this was now scaled up within 10 counties within the country. Now, for purposes of this presentation, I'll be focusing on the female sex workers and the men who have sex with men. Next slide, please. Now, I wanted to just take you through our demand creation framework, and this more or less formed the basis of our strategy in terms of how we wanted to introduce PrEP into the market and how we wanted to focus our demand creation efforts. So for us to start off with, advocacy was really important at the point where now we were thinking about how do we scale up PrEP in the country. And here is when we were able to work very closely with our national government, with the National AIDS and STI Control program, which is run by the Ministry of Health. And we also worked with different implementing partners as well as stakeholder groups, including religious organizations, as well as community leaders and even county officials, to see how we can develop, to do advocacy to help us to develop, our demand creation strategy and how we were going to introduce it into the country. So the second thing that we really focused on, and I would want to mention that as a country, Kenya, and this was formed at the basis of our technical working group, we decided to introduce PrEP by first creating general awareness. And this was very deliberate because from the different stakeholder meetings that we had during the advocacy stage with the implementing partners, with the religious organizations, with also users themselves, we realized that if we introduce PrEP as a product for key population, then this would significantly lead to stigma among the key population. And thus, as a country, we decided that let's first create and set the stage for PrEP introduction and let everyone be aware about it. And we did this through now mass media campaign. And we also had a lot of social media engagements as well as promotional events. And this actually helped us to just be able to create a very conducive environment where at the point where we'd want to now run targeted communication with the different populations, then we'll have a more positive outcome from that experience as well. Then the other strategy that we took was now, at the point where now we've been able to do general awareness, we were now able to conduct human-centered design and behavioral economics research, and to use this process to be able to really craft user-centered interventions. And this was done through a process of co-design with the users themselves to see what would work for them at the point where we're talking about PrEP, what interventions would be ideal. And we were able to test several interventions, and the ones that were accepted is what we were able to scale up. And then lastly, in terms of our strategy, is at the point where now, yes, you're conducting your demand creation activities and you are doing a lot of targeted demand creation, but how do you support the PrEP delivery? And here is at the point where now, at the facility and also at the community level, how do you ensure that, one, you have the structures in place? And here is where we're looking at interpersonal communication. How do you work with peer mobilizers to ensure that they're driving the mobilization of users to the facility where they can also be able to receive seamless services at the point where now they're asking about PrEP. And next slide, please. So for us, in terms of our HCD strategy and both even behavioral economics, for us it was around, how do we just drive innovation for demand creation? And we really wanted to just be clear in terms of what we were framing as our design question, which I mentioned in the earlier slide, and then just being able to explore different options around, who these users are, how do we segment these users, and develop ideas that we were able to test out and pilot. And out of this now, we were able to pilot and measure and make changes on the different interventions that we had. And then at the end of it now, the interventions that were well accepted is what now we were able to scale up and evaluate the demand creation interventions. Next slide, please. So I'll be taking you through now from our HCD process that we went through with our population MSM. There were 3 key insights that came out from this process. And the first insight being around, for MSM, they felt that they don't see pictures of themselves in the media, and they feel that people don't understand them. And the second insight that came out from the HCD process was around, tell them deep truths that they want to connect with. If they see a communication, how can they look at that communication and they feel that speaks to them? And then the third insight was around, for MSM, peer influence is really big for them. So it's about now being able to use key influencers to more or less to drive the conversations around PrEP among MSM. Next slide, please. So from the insights that we were able to derive from the HCD process, now we went through several reiterations, we piloted several ideas, but out of these ideas, these 4 ideas are what now we were able to test, to pilot, and to scale up as well. And the first being the Let's Get Real digital media campaign. And why we call this the Let's Get Real digital campaign, it was pegged on that insight of MSM wanting to see communication that relates to them. They wanted to see communication that tells them deep truths about them. And for a campaign that we called Let's Get Real, this was a campaign that went completely viral among MSM because, one, they felt that it was communication that relates to them. And also we were able to work closely with MSM civil society organizations where they had private social media accounts, and they were able to drive communication and social media campaigns within these private accounts to target now the closeted MSM. So it gained a lot of traction among them because, one, they felt that this is communication that relates to them. And then the second intervention that we were able to scale up was what we call media lifestyle content. And this was pegged on the insight of, I want to see communication that relates to me, but also I do not want to receive information that is only health related. So how we were able to position our communication was around being able to drive non-health lifestyle content. And within those non-health lifestyle content is where now we were able to have PrEP information that MSM would be able to access and be able to connect with. And then the third intervention that we were able to scale up was what we call Let's Get Real events. And this was also pegged on the first intervention, the digital campaign. And as you can see, the hashtag is Let's Get Real events. And this was events, social events that targets MSM community. And these are private social events that MSM community would be able to invite other MSM community members. And within this event is where now you'll have peer educators who would be able to interact with different people, talk to them about PrEP. They'll be able to get their contact information for those who are willing to disclose their information. They'll be willing to have a photo booth where they'll be able to take photos of themselves in these events, wearing t-shirts called Let's Get Real. So it was a very, the idea was just to give them a space where the MSM community felt connected, they felt that people understand them, and also just to be able to also give peer educators a forum where they can be able to reach possible users of PrEP. So what happens is after the events are done is where now for the MSM community members who were willing to be reached were contacted and invited to come to the drop-in centers and to be able now to receive now PrEP for those who now would want to sign up for PrEP. And then the last intervention that we were able to roll out was what we call discovery video. And here is where now we were talking about creating short videos following the life of an MSM and his journey on PrEP. And the way in which we created this video was we wanted to just paint a very real picture among MSM. And these videos are something that would be shared on WhatsApp, would be shared among MSM to show that, you know what, this is something that, you know, works for me. And this is something that, you know, even if I want my fellow peers to see, they'll be willing also to want to sign up on PrEP as well. Next slide, please. Now, for us, I think the outcomes from the interventions that we rolled out that we call Let's Get Real interventions, we had very positive outcomes because one, for the 6 civil society organizations that were able to now have these campaigns running on the social media platforms, we witnessed a very steady increase in followers. And then the second thing is that even for the events that we were able to carry out for Let's Get Real events, for the peer educators who were able to now reach people within those events, and we were able to contact, I mean, on an average of 47,000, you know, MSM contacts, and from that, you know, 1,644 of them were initiated on PrEP. So for us, it was quite significant because we realized that this is just one way that we can be able to reach, especially the MSM who do not want to be out in the open, and as a way to just feel that they connect to the messaging and the communication that we were putting out there as well. Next slide, please. Now, for the female sex worker, we also were able to derive insights from the human-centered design research process that we did. And among these insights, the first insight being around, you know, for female sex workers, for them, they don't feel that you should tell them what to do. And this, this insight actually came up from the aspect to do with, you know, a female sex worker felt that, you know, they were not relating very well with the peer educators that they were talking to. And for them that even as a peer educator was trying to mobilize them and to give them information on PrEP, that they were not well equipped with the right information to approach them as well. Then the second insight that came out was around, you know, for female sex workers, they're not ashamed of their work. For them, sex work is real work. So, I mean, that's an insight that we had to now use and to see how we could craft communication that was relevant for them. Then lastly, the third insight that we were able to derive from the process was around, you know, they do not want to be seen by their clients to be using PrEP. So how do you hide your PrEP pills while still being able to carry out your work? And especially because this insight came out from the insight around the PrEP medication and the PrEP pill case being associated with HIV. And so it's now seeing how we could be able to now use these insights to create interventions that are relevant for them. Next slide, please. So for the female sex workers, we developed 4 interventions. The first intervention being the glow in the dark bag. And this is a knapsack. And the word Ask Me About PrEP was designed to glow in the dark. So the idea was to now, we equipped our peer educators, especially the peer educators who now were mobilizing for female sex workers. And they would carry these bags when they go to hotspots at night. And within these bags, they'd be able to carry flyers, they'd be able to carry condoms, they'd be able to carry lubricants that they can distribute even during the hotspot sessions. But then the idea was at the point where now they're walking to the hotspots, when a female sex worker sees the bag, immediately they'll ask, hey, what is this PrEP? could you give me more information? So it would actually help peer educators as a way to help them as a conversation starter to initiate the conversations on PrEP. Then the second intervention that we rolled out was around, how do we now equip our peer educators with the right information? How do we build their confidence? How do we give them the information that could help them to demystify PrEP? And here is where now we designed a facilitation guide. And this was a small booklet that they could carry with them at any given point. So at the point where now they feel they're not confident and they want to now have more information, as they mobilize, they'd refer back to it. So we created this with the peer educators in mind, and as a way for them also to be able to identify the different segments within the female sex workers themselves. Then the third intervention that we developed was what we call the goodie bag with non-rattling pill carrier. And this was a simple Ankara designed bag, which we designed to address the insights from female sex workers around. They want to carry the PrEP medication, but they want to be very conspicuous because they do not want their clients or their peers to see them taking the medication. So here is when we designed a bag that they could carry their pill medication. They could also carry their personal items if it's money, if it's makeup, and it did not have any branding whatsoever. So a female sex worker would feel very confident walking around with it, even going to work or walking into a public transport, because it would not be able to disclose the information that they have. Then the other intervention that we had was what we call the rapid up pill carrier. And this is where now we had we'd encourage now female sex workers to wrap 3 pills within condoms. And at the point where now they are going out into the field, in case they do not have their pill medication with them, then they can always take their medication as well. Next slide, please. So I think for us, what came out from the data for female sex workers was that, it was effective to, at the point where we were able to train and equip the peer educators with the right information as well as the tools, then they were able to better mobilize female sex workers when they go out to the hotspots. Next slide, please. So for us, key lessons that we were able to learn was, one, I think the role of national government was very important. And for us, we had the leadership of the Ministry of Health, and they played a very key role in setting the stage for PrEP introduction in the country as well. And then the second lesson that we learned was around evaluation and measurement. And here's where we were able to learn that it's really important for you to be able to know how you're going to evaluate and measure your demand creation interventions before the start of the implementation. Then another lesson for us was around, there's a lot of value in co-design process. And here is where now, when you involve the users, you're able to learn and gain a lot of insights, which would help to shape and design better user-centered interventions as well. Then fourthly, another key lesson for us was around, there was strength in peer mobilization structures among MSM and female sex workers, because within these communities, peer mobilizers were very strong influencers, and they were able to actually influence individual behavior and how they would want to now know more information about PrEP. Then lastly, it's really important that at a point where now you are introducing and you are running demand creation interventions, it's really important that you align demand creation with service delivery to ensure that there is no gap in the PrEP cascade, and at the point where users can receive very seamless experience at the point where now they want to receive the services. And lastly, next slide, please. Lastly, I just want to briefly talk about, if we're to do it differently, I think for us, what I would want to talk about, one, I would want to build the internal capacity of our HCD process to ensure that, all internal stakeholders are aware about HCD and they're able to actually appreciate the process and the outcomes of the research itself. And then secondly, it's really important, and I talked about it earlier, to just be able to be clear about how you're going to measure your interventions and how you're going to measure all your communication impact as well. And then lastly, I would also want to talk about, it's really important that in your communication, you also think about how you can combine PrEP information with other information to do with family planning, because as a product itself, it cannot be marketed as a standalone product on its own. And then lastly, if I could mention, is looking at how, when you're looking at developing communication for PrEP, and at the point where you're introducing this product, it's really important you think about how you're going to communicate, not only to look at PrEP uptake, but also to look at communication continuation, because this is an area that we realized was a challenge for us, we focused a lot on in terms of information that we need to pass to users on how they need to know about PrEP. But in terms of continuation is where now they were not able to get the information, and we had to develop that communication. So thank you very much, and I'll now hand it over back to Katie.
Thank you so much, Agelgel. That was excellent. Aubrey, could we go to the next slide, please? There are a few questions in the chat. Please feel free to add more. One of the questions is from Brian. Brian, why don't you take yourself off mute and you can go ahead and ask.
Great, thanks. Thank you, Agelgel, for that great presentation. I'm curious just to know how in Jilinde are you collecting feedback from your audiences? You know, interventions are rarely static, and conditions and context changes. And so when you're using these highly specialized design techniques to really get at, you know, what are the core motivators for people to do stuff, I would imagine that over time those shift or those change. So how are you collecting feedback from audiences on a regular basis, and how are you using that information to sort of adapt or modify your interventions or tools or messages?
Thank you, Brian, for that question. In terms of how the project is collecting information is at the facility level, we created client feedback form. And here is where now we were able to collect information from clients in terms of the user experience. And this is at the point where now they would interact with the service provider. And even for PrEP users who maybe were able to sign up on PrEP and then drop off after a month, we'd want to also get that feedback from them, you know, at the point of just getting to know what the experience is and how we can be able to better develop, communication that is relevant for them. So I think for us, it was really important that we developed the client feedback form, and also we had the client exit form where now we were able to use that data to more or less to guide our program in terms of how we could better now develop interventions that was relevant for them.
Okay. And Katie, can I ask a follow-on? Because Agelgel said something that provoked
Sure.
another question.
Mm-hmm.
You mentioned that you are collecting information from clients that stop using PrEP. What are some of the things that you're hearing about why a client that one day is motivated to try PrEP ends up stopping to use PrEP?
Okay, thank you, Brian. Okay, so some of the feedback that we received was, one, it was around the side effects. Two, it was about the pill burden itself, because for PrEP pill, you have to take it daily. And for users, some of them would say they would forget to take the pill, and then they'll think that their HIV risk was no longer important. So I think those are some of the feedback that we've been able to receive, and to really use that feedback to see how we could now be able to craft our communication.
Okay, thank you.
Okay, there is a question about how to tackle government policies that criminalize men who have sex with men. And of course, in that context, it's difficult to gain access to those populations. You know, particularly, you know, in Nigeria was used as an example, but certainly there are others. Does anybody have thoughts on that? And we can also open it up. There's about 50 people on this call. If there are experiences with that and thoughts from anybody, from our speakers or on the webinar, please, I'd open the floor to that. It's an important question. Laraba, feel free to unmute yourself and elaborate on that question if you'd like.
Katie, this is Kent Clandera from USAID. I can talk briefly. This is a major challenge, yeah. And I think kind of lessons learned from other countries is using a health agenda to sort of help recognize that criminalization of same-sex behavior or criminalization of sex work, right, is a challenge for our work. And so, however, when we address those issues, we see better health outcomes. And so I think, you know, to me, it's about having that data. I think it's a bit beyond the work that we have to advocate for that. But I think a lot of the CSOs we work with, a lot of the advocates we work with, it's in their ballywick, right? So how do we help them get that data and have that information to be able to help recognize that, you know, challenging these policies and laws will help us see better health outcomes. And as we have the data to prove that. So, you know, yeah, I don't know if that helps. It's a challenge, and I don't think it's a, you know, with PEPFAR, we're often on an annual cycle. It's not something that's going to happen in 1 year. It's a strategy that's going to take several years. But we need to keep raising it. We need to keep asking the question. Thanks.
Thanks, Kent. Does anyone have anything else they'd like to add on this, or further questions related to this, criminalization of either sex workers or same-sex relationships?
So this is Manya. So something that that we saw was effective in Kenya, and this is not a direct answer to decriminalizing homosexuality or sex work, but rather communicating that PrEP is for everyone, and talking about, really not talking about it in those terms, like it's for sex workers, it's for men who have sex with men, but rather looking at, just kind of discussing risk more broadly, and discussing that risk is both sometimes internally driven and sometimes externally driven, that you can be doing everything quote unquote right to protect yourself, and your partner can not be. So, one of the ways that Kenya attacked that discussion of PrEP was to work very closely with journalists to get ahead of rumors, to get ahead of any bad press that might come, or press that was highlighting activities with key populations, so that it could say, PrEP is really safe for anyone, and risk, there's lots of ways that people find themselves at risk in spite of their best intentions. So it's not an exact answer, but it's a way that we talk about it that isn't excluding anyone. It's an inclusive conversation.
Thanks, Manya. So another question for Agegal from Ghana. The West Africa AIDS Foundation started implementing PrEP in August of this year among FSWs and MSM. For FSWs, the initial challenge was their commitment to pay costs of lab tests related to PrEP initiation. For the short-term measure, there was donor support with a subsidy for the duration of the project, but this was not sustainable. In Kenya, for your implementation with FSWs, did you face this challenge as well? And if so, how did you address it? And how can this be more sustainable?
Okay, thank you for that question, Bena. So in terms of our model in Kenya for female sex workers, what we did as a project is we were able to strengthen the capacity of local civil society organizations who offer services to female sex workers. And by strengthening the capacity, we were able now to be able to ensure that, they would have a more or less like a drop-in center model, where now female sex workers would be able to receive PrEP services for free, and at the point where any tests related to their PrEP initiations would be offered for free within the drop-in centers and the CSOs that we were working with. So for us, we realized that this was a more effective model because for us, it was really important that we could be able to work with organizations that already have established systems that can be able to target female sex workers. Thank you.
And I just wanted to add to that, that many countries are, you know, a lot of the lab tests are just required for initiation of PrEP, and really it's just the HIV test that is required, and others are recommended. So I think, is there, you know, flexibility around that? You know, if the one you're speaking of is specific to creatinine clearance, if that is more flexible in your national guidelines or not, and can, you know, something that could be done at some point down the road, but not necessarily required for initiation if there's no, you know, if there's no clear evidence of a need for that test from a clinical standpoint. That's just an added thought.
Yeah, and then maybe I can just also briefly add as well. And I think for us also, what I didn't mention was for Kenya, it was really important from a national level that we had taken the necessary steps to ensure that we had clear guidelines so that it was able to more or less create a very seamless more or less engagement with the local CSOs for the female sex workers. So he is where now, through the national guidelines, it was able to guide the implementation and to guide even the service experience at the point where now the services are being offered to the female sex workers themselves. Thank you.
Great. And before we move to the next presentation, I would like to just ask Agelgel and Manya to put in the chat if any of these materials are available publicly. I think it's always nice to see aspects of the campaign, of the Let's Get Real campaign, or the work done with FSWs, if there are links available to the facilitation guide and toolkit, or the peer facilitator guide and toolkit. I think it's always nice for programs to see what others are doing and build off of things that are in existence. Aubrey, can we go to the next slide, please? And so next we will hear from the Jopaigo team in Lesotho, Polo Motswari, on creating demand for PrEP services among adolescent girls and young women. So Polo, I'll turn it over to you. Thanks.
Hi, everyone. Be sure that you can hear me very well, because the question somehow.
Polo, it is breaking up quite a bit.
Oh no. Yeah, that's a problem.
Oh, that's too bad, because you were very clear an hour ago.
I know. So there's a storm here, so everything stopped. Yeah.
Okay. Well, do you want to go ahead and try? I'm not sure on the translation side if they will be able to hear you very well, but we can give it a go. And Manya, I don't know how familiar you are with this presentation. If you would be able to support if Polo isn't able to.
Yeah, I will do my best.
Very clear. Okay, Polo, let's give it a try.
Okay, let me try. So my name is Mutari. I work for Jopaigo in communication office as communication manager. So I'll be talking about how we've created demand for GYW on PrEP. Thank you. Next. We are creating for migration. So the prevalence to 5%, and the highest incidence of HIV is amongst men of the age of 35 to 49 years, and females of the age of 15 to 24, which we are targeting at 1.49%. So TEPA primarily targets on AGYW for PrEP services, and we also have a few SW that would be adolescents and of course. Next slide, please. So we started with a few activities when we were trying to create demand, but as time goes on, as I will share later, we now added the design so that we are able to hear what young people are saying, their experiences and their perspective on how this should be provided. Then this is especially what I'm going to present now as we create my PrEP. Next slide, please. So demand strategies, we on this presentation to show how, like, where we do. So two of the main strategies that we use are pre-mobilization and instant mobilization. And for both, I will talk about maybe disadvantages and advantages of both so that we understand what we went through and what happened as we improved our demand creation. So we do pre-mobilization a week prior to service delivery. This is, we go to a village, or because we give service more village is a community-based so we go to that community prior to and we do mobilization. This is engaging everyone. Could be in groups, could be adolescents because they're our primary target audience, but also we now target all those secondary audience, being parents, being chiefs, authorities, so that they appreciate and understand that we'll be coming with the services, and also to kind of destigmatize the service and the people that are using PrEP. So what we have seen is during pre-mobilization, because people make decisions as we come along, you talk with them this week, and then next week you bring services. Now we find people that are already ready to get service, that understand, that have pondered, about what PrEP is, if they really need the services. So at times, we find that the numbers are not that high because some, checking out in a way, or they just decide that, no, it's not for me, I am not going to take PrEP. But it's a very positive thing because at times, because the people that make the decision to take PrEP are the ones who think they really need to, and now they will continue using it maybe further. And the instability on the or somewhere, and are there with our tents, we're ready to give services, and now people instantly take PrEP. You can understand that now this one doesn't really give people a lot of time to think about that decision, but it has still worked a lot, and because it has marketed in a way, made people aware of PrEP. And people sometimes have to try something and then make it and that they don't want to use. So we still, even though it has, pros and cons. So where do we mobilize? Because we are targeting adolescent girls and women that are in 24, we go to high schools with different activities. We talk to the principals, the school authorities, to allow us to talk to the girls and of the boys, of course, but then we are allowed them to, like, pre-mobilization, point them to the direction of where we will be with the services, to our resource centers and everywhere, so that they're able to get the services. One of our biggest targets is the tertiary institutions, where now they have all the freedom, they can make decisions easily. So we go and have made MOUs with most of the tertiary schools, and then we are able to go there and talk with them. We go to the shopping centers where young people hang out and they want cool shops, and we prep very cool and then we talk them, give this necessary. Is able to talk to people in the household if necessary. Because sometimes you find out that want their parents to know that they're using PrEP. A mother is interested not you talking about questions or or that support system the adolescent getting very well. Next slide, please. These are some of the activities and some of the materials that we have used to create demand for PrEP. So in the middle, if I can start there, there's a brochure or a leaflet, let me put it that way, that is colorful. It is for the one that has purple, green, and so on. It is the one that we developed especially for our national university. We have only one university in Lesotho, but after talking with them, we then made this material so that they're able to read it, they're able to relate with it, and so on. So this is particularly for the tertiaries. On the far left, where there are girls in a circle kind of playing or having a good time, this is one of the strategies that we use for these girls. All of them have been at least on 1 month PrEP, using PrEP. Now, they are, after a month, we call them back in all the sites that we work at, and then we kind of motivate them. Girls sometimes feel like, am I the only one with all the stigma and this understanding of PrEP? So together from they talk about pilings, they talk about how hot wonder, and so on. And this is so it helps being able to together to know if they want to continue kind of in a way, now they have the confidence. They're also able to go back to their friends and talk about their experiences and maybe motivate to use PrEP if necessary. So these are the ones materials, for instance, that were the materials are on PrEP, the leaflets that are printed in both Lesotho and English. And then there's a mobile unit where we go to these young people, the adolescent girls, where they are, and then we pitch the tents, and then we talk with them and provide services. If I can maybe go to where there is a T-shirt with somebody talking to the young adolescent girls, is written, ask me about PrEP. So we've developed materials like that, where some of the young people, because of our different cultures, are kind of shy or cannot come forth and ask questions about stuff. So when they see this, and it has worked very well, when they see T-shirts like ask me about PrEP, now they're able to just kind of take somebody aside and ask, do you know about PrEP? We've heard about it. So we have developed different materials that evoke or kind of help people to start discussions. And we have all those other promotional materials, the pink ones, and then how we do door-to-door, especially now during COVID, using masks, physical distancing, and so on. Next slide, please.
Polo, sorry to interrupt. I'm just going to take off your video and see if that might help with the connection a little bit.
That's okay.
Thank you. Okay, go ahead.
All right. So this slide is just to share the demand creation teams that we developed. So as I said earlier, at first we had, we still do though, but that's how we started with full-time community health promoters. There are full-time staff at Jilinde that work in different districts. But then after we had and talked with these adolescent girls through the human-centered, we now developed a lot of other things that helped them to relax, to be able to talk with their peers and so on. That's when we developed or introduced volunteer community advocates. These are adolescent girls that are using PrEP already, and they are collected or recruited from different areas where they are already, very articulate. They're able to talk to young people already. So we kind of work with authorities in the villages, in their schools, in the tertiaries, to identify the ones that we can talk to. So all of those are trained for 3 days, given all the basic information and how to mobilize and all the strategies that they can use, even tools that they can use to report and so on. That's one strategy that has worked very, very well for us. Then later, we also now, before I go to the PrEP stars, the VCAs, the volunteer community advocates, we've started with them since 2018. We still have them, some of them now, but we recruit as need arise, and then we also give them refreshers. We help them and support them anyhow. And then later we saw that, this PrEP stars, we now introduced what we called PrEP stars. So these are kind of, you remember the picture that I showed you where they have a circle? Those are the PrEP stars. They are young people who have friends that they can talk to. They are not normally given any form of training. It's kind of a snowball kind of activity where they talk to their friends, and they are only allowed to bring at least five clients to refer them, and then they stop. We don't continue for a long time with them because they are not trained, and we feel like it's not everyone who may have more than 5, friends, while the volunteers up there are able to bring anybody, any community member that they can bring, but working a lot on AGYW. So we have the PrEP stars and then the volunteers, the community advocates. And we also have collaborated a lot with civil society organizations through subgrantees. So Japaigo advertised for subgrantees, and they were grants awarded, where we are now able to talk to these girls, young girls, where they are already supported. It's easier to talk to them. Some of these organizations have maybe clubs at schools, they are already aging these adolescent girls, so it's easier to kind of go with them and train them and help them to attract the young girls. Next slide, please. Just a few of some of the activities that we do as well. We use a lot of edutainment, where we bring a DJ, somebody who plays music that is appealing to young girls, and then it's easier to attract them wherever they are. Now they come to that kind of listen to music, they participate in any activity that is there. The main thing is to kind of talk with them, give them information about HIV prevention, give them quizzes so that we hear that they are listening, direct them to where the PrEP services will be. Then that's where we now use our promotional material. When we started, the promotional material was given to people or clients that come for services. But as time went on, felt that maybe poor country to get stuff. Am I still there?
You are. We did have you cut out just a little bit, but you are back, it sounds like.
You are, and Polo, we are getting a little tight on time. So if you could actually wrap up in the next couple of minutes.
I am. Okay.
Thank you.
We can go to the next slide. This was just about edutainment, so we can go to the next slide. And then we use Facebook, that is very popular social media in Lesotho. That's what we use a lot. And then we kind of research in a way, find things that are trending in the country and everywhere else, so that we kind of domesticate them to kind of promote PrEP. If you see particularly this first upload was on if we we don't know who you're talking to or who will be looking at this. It was more talking about condoms, but then we turned into PrEP. And then this Facebook page is connected to our WhatsApp business that is put in all the material that we produce, our billboards, our everything, so that people now are kind of individually and secretly are able to talk to us on our WhatsApp page. So questions are answered daily. We can move to the next slide. I think I have only 2 left now. And another media that we use, like I said, is the WhatsApp, and I've already talked about it being the number being everywhere with all the material that we print, and then the status that we use for WhatsApp, because a lot of young girls are on WhatsApp. We put status about information on PrEP and when they can get services. We have a radio program where now we have a 30 minutes live radio program where we bring a host. It could be a young girl motivating others. It could be a clinician or a nurse talking about benefits, and then the community and the young people that are listening engage as well. Thank you. Next slide. So this is just an average of when we started in 2018. You see in January, we were celebrating our first 53 initiations with a very low number of adolescent girls, but in August, and things started to change and we're being a bit more encouraged. And for the 3 years now, we have enrolled 20,000 PrEP users. Next slide. I think this is the last one. So what could we have done differently? At first, we felt like the earlier presenters were saying that the messaging was kind of resulting into stigma when you're saying you want young girls. So people were kind of feeling like maybe PrEP is not for everyone. With our HIV prevalence, PrEP could be for everyone. So they felt it is not for me. So we started changing those messages and talking more. But when we talked to female sex workers and men having sex with other men, then it was easier because it was on a safe place where we now can talk about everything, make relevant examples, and be direct where we wanted to. Another thing is the promotion was more targeting adolescent girls, empowering them. Then later we saw that a lot of them were not continuing, not because they didn't want to, but because we had not empowered their partners, their friends, this other key population that, the population that helps them to make decisions. So we now started with pre-mobilization. We're having, particular messages are only talking to those people that support them. Next slide. I think that was the last one. Thank you very much.
Thank you, Polo. Great. I think we have time for one question. If there are any questions for Polo and the Lesotho Jopaigo team. And again, Polo, if there are any specific materials that are publicly accessible, it would be great to share those out. It's always nice to see an exchange of materials across the group. If you have things to share, I know Igelgal put some links in the chat of the Kenya program.
Okay, I will share. There's a number of videos that we did, 1-minute videos that talk to parents, encouraging, all these target audiences. So I will share all those videos.
Thank you. And I also I didn't know if anybody on the line, there's many countries represented on this call today from throughout West Africa. If anybody had any questions or comments about demand creation challenges or situations in your country particularly. And we can, if you have, we can always follow up offline after the webinar regarding those too, if there are specific questions that you have. Okay, let's go ahead to the next slide, please. And there we go. Brian Pedersen from FHI 360 will just go through some final thoughts, and then we'll wrap that up. Thank you. Go ahead, Brian.
Thank you, Katie. So when Mani and I were pulling together this webinar, taking into account, the experiences that would be shared by Lesotho and Kenya, we wanted to give just a couple of final thoughts, just to sort of make sure that if you remember nothing else from our discussion today, you take this forward with you. And we also wanted to use it as an opportunity to challenge you, to maybe try to do things differently than how we've done them in other countries, since we recognize that many countries in West Africa are just beginning the process of ramping up their demand creation activities. So next slide. So the big take-home message that we're hoping you got from the lessons that were shared by both Manya as well as the two countries is that awareness does not equal acceptance. I think it seems like an obvious lesson that most of us have taken to heart in most of our programs, but you would be surprised at how many programs we've worked with that really most of their messaging and most of the activities that they're doing are premised on this idea that just by raising awareness about what is PrEP, what are the benefits of PrEP, where can you get PrEP, is going to somehow immediately lead to acceptance, which is going to result in uptake and continuation. But I think what we've learned over the past couple of years of rolling out PrEP is that acceptance or awareness is something that may help, but doesn't immediately lead to acceptance. So next slide. And when you look at all the experiences of other countries and the research that's been done, we find that awareness is just one small piece of all the things that need to come together in order to build acceptance. So we encourage you in your programs to think about, how do you communicate about social support? How do you create social support? How do you communicate about side effects and risk and stigma around PrEP, not just awareness, so that we really get to a point where not only potential users, but all the people around them that influence their decisions really accept the benefits and accept the importance of a product like oral PrEP, and address those things that may stigmatize PrEP use, either because of its association with HIV or association with certain behaviors or certain populations in a community. Next slide. And so I think this is where we want to sort of present a challenge to you all that are just starting to get working on scaling up demand creation activities, is don't go down the path of just raising awareness, which I think a lot of programs have done in the past. But we really want you to think right out of the gate, how can you be more holistic in your programming? Next slide. And so we won't have time to go through this, but what we're asking is, as you begin to design your programs, think about how we might norm PrEP in a community, not just raise awareness, but actually make PrEP a normal, acceptable behavior. And how might we destigmatize being at risk of HIV and being a great candidate or a great person or a good candidate for PrEP use. And so again, you'll get these slides so you can dig into this a little bit more, but how can we create those conditions around every individual so that they want to use PrEP and see it as something that's acceptable in their community? So again, that's sort of the challenge that we want to put to you all, is to maybe move beyond thinking about how do we increase awareness of PrEP and think more about how might we create a norm around PrEP use, or how might we destigmatize using PrEP or being at risk of HIV infection so that PrEP is a good product for you. And I think that's pretty much it. If you click, and the reason, we recognize that raising awareness is easy, and challenging you to think more about norming PrEP and addressing stigma is difficult, but we want to make the argument that PrEP is worth it. When you talk to people that have used PrEP, or the people that could benefit from PrEP, they have not only, but most of them have really great things to say about PrEP and how important it is and how it empowers them to take control over their own health and their own HIV prevention. And so while it's difficult to think about norming PrEP and difficult to address the stigma around risk and PrEP use, it's a worthy cause and it's a worthy challenge for us to always keep our eye on those things, so that we can actually we can see more and more people using PrEP and benefiting from the great things that PrEP can provide. So those are just the final thoughts and words that Manya and I wanted to leave you with. So if you remember nothing else, just remember that awareness does not equal acceptance, and please accept the challenge to think about how we can norm PrEP, since it's a worthy product of our additional effort. So that's it.
Thanks, Brian. Next slide, Aubrey. I just want to wrap things up quickly here. I think Casey has asked folks in the chat, if you could please go to the participant list and let us know if you're currently listening in French. It's helpful to know if people are using the translation services that we have here. There's a green check mark for yes or a no button. Getting some feedback on that would be really helpful. Also, in terms of our upcoming sessions, we do have a session on December 10th. This is a different day than we usually have these sessions on, but we are collaborating with Palladium and HP Plus projects to deliver a PrEP costing and target setting webinar to help prepare for COP planning. So we hope you can join. It will be at the same time, and we will get the calendar invites out earlier than we have in the past. So I apologize for that delay for this session. In January, we will be talking about healthcare provider training, and in February on PrEP and intimate partner violence. So we hope you can join for those. The link is here to sign up for the direct emails and invites for these sessions if you want to join. Casey has put this in the chat as well. Next slide. And of course, on PrEP Watch, the recording for this webinar, as well as the French and the English presentations, will be available. And that's where you can also find out about upcoming sessions for the West Africa Regional PrEP Learning Network. Next slide. Great. So thank you very much. Have a great day, everybody. And we will see you hopefully in December. Thank you.